We have a significant opportunity right now to enhance the quality of people's lives by investing in mental health services provided in Leicester, Leicestershire and Rutland. Our mental health heavily influences our whole health and well-being, and it's as important as our physical health. We at the NHS recognise this and are investing more in local services to dramatically improve care and treatment. We want to help everyone living locally to thrive and live the life they want. We've been working with individuals for some time now to really understand what they want in their mental health services. We've worked with people who've experienced our services, staff and stakeholders to develop key proposals that we want your views on. Our plan covers two key areas: investing in and improving services for people when their need is urgent and when they need planned care and treatment.
How can we make sure that we use our resources and our investment for the best needs of the whole population, and that we structure our services to meet service users' needs and carers' needs in the best possible way? We think we've done lots of good things around that, but we think we've got lots of ideas within this consultation that will make it stronger and a better service for people, and a more integrated service for people, an easier service to navigate, and there'll be better outcomes for people and their families.
When the need is urgent, people said they wanted an easier way of getting help at any time of the day or night, and they wanted to get this help quickly and directly. This feedback underpins our proposals for change. We want to deliver better advice and guidance, so when people are first looking for support or even just information, they can find it all in one place, online. When individuals need more help or are in a crisis, we recognise it's important there's a place they can contact 24 hours a day, 7 days a week, by phone or text. We want to introduce a new central access point for people so they can do this.
Patients have been able to call us directly if they were struggling without having to attend A&E. So therefore that's actually reduced the number of people going to A&E that could have access to mental health services without any other service having to refer them.
An important aspect of the central access point is the crisis service. This means people can get help directly without contacting their GP and get an assessment within 4 hours if the need is urgent, and within 24 if it's less urgent. Crisis cafes also offer urgent help. We have 3 already, and they provide a safe space for people to get help when they're experiencing a crisis. We want to increase the number to 25 and are asking where people want them located and what services they could provide.
The Crisis Cafe is a really important part of what we do to support people in the community with mental health issues. It's somewhere they can come where it's safe, it's a welcoming environment, and we help them in terms of looking at what is causing the problems. It may well be that there's a financial issue, the relationship issue, it may well be it's a mental health issue itself that's the problem, but a lot of the time people actually just need someone to talk through their issues, get the help that they need and meet other people.
We want to increase the mental health support in emergency services to better support individuals when incidents occur. We're proposing to expand our existing triage car service to work longer hours and cover both police and ambulance services. During the pandemic, we quickly set up the Mental Health Urgent Care Hub to provide more targeted support away from the emergency department. It's a space the emergency services, social care or other health professionals can refer into and offers people a rapid assessment and support. Through our proposals, we're looking to make the changes permanent. When people experience ill mental health, they may go to the hospital's emergency department for help. There's now extra expertise there 24 hours a day, 7 days a week in the emergency department. This is called the Acute Mental Health Liaison Service. It also helps people who are already on a hospital ward. Finally, there are individuals who are particularly vulnerable, who need mental health support urgently, but for various reasons don't access it. There are currently 3 teams working with vulnerable groups, including homeless people and individuals that present in the criminal justice system. We propose to bring these teams together into one dedicated service to help more vulnerable people access the care they need. So to improve mental health care for people who need urgent help, We want to provide self-help and guidance, further develop the central access point, create more and strengthen the role of crisis cafes and improve crisis services, expand the use of the triage car, introduce permanently a mental health urgent care hub and an acute mental health liaison service, join up services that support particularly vulnerable groups of individuals with mental health needs that do not access the support they need. The second key area is improving planned care and treatment. People told us they wanted as much care as possible to be provided near to where they live and be organised around their needs and the needs of their local community. We've listened to this feedback and developed the following proposals. We have a number of teams working separately, with some work being duplicated or triplicated, and long waits as people are passed between different teams. We want to bring these together into 8 new community treatment and recovery teams, working in local areas to support adults. They would work alongside an additional 8 teams who would focus on specific mental health needs of older people. These local teams would be supported, if needed, by other experts to provide more focused support. This includes help for women pre- and post-birth, and for people with complex personality disorder, also those with early signs of psychosis, difficulties with memory, and for individuals that have complex needs who will benefit from community-based mental health rehabilitation to support their recovery needs. So our plans are to work with local communities to provide better planned care and treatment, reduce waiting times for treatment and join up services to create a local seamless experience, improve support for individuals with personality disorder, improve services for people of work age and older people, expand perinatal services for the time immediately before and after birth, and develop a maternal outreach service. Improve the experience for people with potential psychosis, reduce the wait for a diagnosis of dementia, and provide rehabilitation support to help people recover from complex psychosis.
This is a once-in-a-generation opportunity for us to deliver the mental health services that people in Leicester, Leicestershire and Rutland truly deserve. Please take your time to have your say, whether you've used our services now or in the past, or simply know somebody that needs or relies on mental health services. We want to know what you think. Visit our website, complete a questionnaire and help make a difference. Step up to great mental health today.